Hi everyone, my name is Samantha Bray, and this is my special population presentation. The population that I chose was oncology, and I chose this because I want to be a pediatric oncology social worker, and I just thought it would be really good just to learn some extra information and inform you all as well. How is working with oncology different from other specialties? Oncology social work is still considered new as it's only been widely practiced since the 1940s. Before the 40s, cancer was almost always fatal and kept a secret for fear of it being contagious. People believed that if you were around someone that had cancer, that you would catch it as well. There are also now hospitals specifically designed for the treatment of cancer. To name a few, there's St. Jude, Memorial Sloan Kettering, as well as Fox Chase Cancer Center, and these are all around the country. And also, you need a master's degree to work in this subspecialty. This is a big reason as to why I'm in this program, besides wanting to continue my education, but I knew if I wanted to get my dream job, I would also need my master's. So challenges and needs specific to the specialty. Challenge 1 is lack of support. The healthcare system does not properly address the psychosocial needs of cancer patients, leaving them feel dissatisfied with the amount of support that they receive. And many patients with cancer who go into remission end up having unmet needs. These unmet needs could include financial stability, emotional stability, as well as daily living. And changes in treatment is the second challenge. Medical models are heavily focused on the biological and clinical aspects of cancer and not the social and psychological factors. This often leaves social workers no place on the interdisciplinary team. There have also been many advances in treatment options, as well as shorter inpatient stays, making it difficult not only for patients who have a lot more to decide, but also for the social workers gives the social workers less time to discuss these options with these patients. And how to address these challenges or needs. So they all go together. You can't do one without the other. The first one, get myself known. Make it known that I am here to ease the patient's transition, and I am a necessary part of this transition. Discuss with the interdisciplinary team the treatment they want while letting them know how I will be involved. I would want to be involved in treatment as much as possible. And I would tell the team from the start, this is what I'm doing with the treatment, and this is how I will be going about it. And also work alongside the entire team. Like I said, it's a team effort. We respect each other and we fight for what we think is right for the patient. Even if you have one idea and the rest of the team has another, you have to work together to figure out the best possible way to address what the patient needs. Discussion question 1 from my previous weeks. According to Berg et al., 2015, women had more needs that were unmet than men in almost all categories. Why do you think that women have more difficulties getting their needs met after becoming a cancer survivor compared to men? Women historically have more responsibility than men. Women are the ones who are typically seen as the people who take care of the house, of the kids, and the cooking and the cleaning. And once in remission, they may feel obligated to continue all of these duties and not ask for help. Also, men don't typically open up about their emotional stability. Men tend to keep their emotions bottled up. There is a stigma that for men, showing emotions is feminine. And in the categories where men had more unmet needs were primarily in physical stability. They can't necessarily do what they used to do before their cancer. They can't work out as well. They maybe lost muscle weight. They can't do whatever they wanted to do like they had previously. And discussion question number 2. If you were a social worker on the interdisciplinary team of a patient who had recently gone into remission, how would you inform both your patient and the rest of the team about the potential issues they may face as they begin the healing process? Discuss the needs from early on in the process. Make sure that the patient is aware from the start what may happen or what could very possibly will happen. Emphasize on the importance of family and friends. The patient needs a strong support system, especially after the patient has gone into remission, but they need it during as well. And remind the patient that it is okay to ask for help. Asking for help does not mean that you're weak. You will not be seen as weak. And it's okay to ask your doctors or your social workers or your family or friends for help in things that you could previously do before, but you can't now. Resources you need as a social worker. Knowledge of support groups in the area. You need to know if there are groups in your patient's area that will take individuals as well as families. What kind of groups they are, what kind of cancer groups they are. The skill to work with individuals as well as families. As a oncology social worker, you will be working with the patient, but you will be also working very heavily with their family as well, especially if the family has children. These children may not understand exactly what is going on with their parent, and they may need help in understanding. Additional information on the disease and possible side effects. Patients may not always feel comfortable asking their doctor because they don't understand what they're saying, or they feel that their doctor is rushing them. So you need to know what this disease can cause, what side effects it can cause, what side effects the medication can cause. And as well, have access to information on groups that can help with the cost of treatment or medications. Unfortunately, cancer is a very expensive disease to have, and a lot of times insurance does not cover a fraction of it. And these treatments or medications are necessary for the survival of the patient. So you need to know if there are church groups or fundraisers that are in their area that can help them with the financial costs of having cancer. Resources you need as the client. Like I said, you need a positive support system. You need friends and family, caregivers, neighbors, coworkers, anybody who can help you just go through it, even if it's just someone to talk to. You need knowledge of the plan of care. You can't just be there and accept that this is what they're going to do and not have a why. You need to understand why you're having surgery, why you're going on this medication, why you're being sent home, why you have to go back into the hospital. And as well, you need assistance in funding, like I said in the previous slide. Cancer is a very expensive disease, and they may not have the funding for it. They may have just gone from a 2-income to a 1-income family. They may have just lost insurance because they can't keep their job due to having the disease. And they need to know where they can go in assistance for funding. How to distinguish yourself from other social workers in the field. Communication skills and the use of open-ended questions to truly understand how my patient is feeling. I want my patient to know that I am not just there to get a paycheck. I want them to know that I am there to listen and help in any way I can, whether that's helping the patient go home or helping them with end-of-life care. Also, become skilled in collaborating with teams that don't always feel the need for a social worker, even though necessary. Like I said before, a lot of interdisciplinary teams feel that a social worker is not a necessary part of the team. And I would just let them know from the start, I am necessary, I will not back down, this is what my patient wants, this is what they need, this is what their family needs, and just make sure I am in that team no matter what. And these are the references that I used for this presentation. I'm looking forward to watching all of your presentations, and good luck in the rest of this class and the rest of our program. We are almost there. We're almost at the end, and it's very exciting. And I will talk to you all soon.